July 21st, 2024 was the hottest day ever recorded, until July 22nd, which was even hotter, with global average temperatures reaching 62.88 degrees Fahrenheit. Keep in mind, that average includes Antarctica. This probably isn't news to you. Lately, it seems like every year is hotter than the last, and every day we're seeing more climate change-charged extreme weather events, from heat waves to wildfires to flooding to droughts. And all that is bad for our health. Climate change means more disasters, worse air quality, more diseases, worse water shortages, more malnutrition, worse mental health, and more death. But all these extreme health risks are preventable. None of this stuff is really new, and we've been dealing with these impacts for millennia. That means we know how to protect people and places, and if we use that knowledge, we can preserve the health and safety of our communities and environments. Hi, I'm Miriam Nielsen, and this is Study Hall Sustainability. When we talk about health here, we're not just talking about individuals, and we're not just talking about not being sick. Health, according to the World Health Organization, is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It's a broad, encompassing term that includes the well-being of people and communities. But humans can't be healthy if our environments are unhealthy. Like other species, we depend on a healthy environment to survive and be well. If our environments are degraded, that can threaten our ability to secure nourishing food, clean water, sanitation, medicine, and materials for heating and shelter. In other words, climate change is really bad for our overall well-being. Take Alaska, where you can see a whole laundry list of the ways climate change is impacting health. First, about 65% of Alaskans rely on subsistence harvesting, including hunting animals like moose, deer, mountain goats, and seals for food. But as temperatures warm and ice seasons get shorter, the areas hunters travel through become less safe during the winter months. This may force hunters to take new, longer, or more dangerous routes, which increase the risk of injury, drowning, exposure, and death. Warming temperatures also affect fishing. As ocean temperatures warm, the Chukchi Sea in northwestern Alaska is already experiencing more harmful algal blooms. With harmful algae comes toxins and oxygen-depleted water, which can poison local marine life. And if people swim or fish in that water or eat infected shellfish, they can become sick. Warming temperatures have also led to thawing permafrost in Alaska, which can release ancient bacteria previously frozen underground for years. And while that might sound like science fiction, it already happened in Siberia. In 2016, an anthrax outbreak in Russia was linked to thawing permafrost. The thaw may have unearthed reindeer carcasses infected with anthrax spores. And then there's increased and more intense wildfires, which affect air quality and can lead to health issues from smoke inhalation. This is especially dangerous for children and people with respiratory and cardiovascular conditions. And extreme weather, such as heavy rain, can lead to flooding, especially along Alaska's coasts and rivers, where there's already increased flood risk from melting glaciers and rising sea levels. Floodwaters can damage homes and communities, threaten lives, and increase risk of illness, as they may damage wastewater treatment systems and carry harmful parasites and viruses. These health risks are particularly concerning for people living in isolated areas who depend on hunting and fishing for food, who have existing health conditions, and who live in small, rural, and poor communities. Physical vulnerabilities are not the only pressure from climate change. For Alaska's indigenous populations, the loss of traditional hunting and fishing practices, or being forced to move away from culturally significant locations and traditional lands, can bring very understandable grief and anxiety. This only scratches the surface of how climate change can impact the health and well-being of Alaskans. And of course, Alaska is far from the only place facing these challenges. Similar health and climate concerns are affecting people all across the globe. Like in 2022, Australia saw its first major outbreak of the mosquito-transmitted viral infection known as Japanese encephalitis. Increased rainfall in Australia meant more standing water where mosquitoes lay eggs. It also created a better climate for birds to migrate from Asia. Experts believe these birds transferred Japanese encephalitis to Australian mosquitoes, then mosquitoes transferred the disease to humans. Mosquito-borne diseases aren't new. Humans all over the world have long contracted diseases from mosquitoes, including malaria, yellow fever, dengue fever, West Nile virus, and Zika. But warmer temperatures, changes in rainfall, and changes in human activity have made outbreaks harder to predict. Floods and droughts can both increase the risk for mosquito-borne diseases, because flooding means there's more standing water where mosquitoes can lay eggs, and drought means people are more likely to keep containers of standing water where mosquitoes can lay eggs. Some mosquitoes have also been found to breed in plastic waste, and many of them thrive in warm temperatures and urban environments, all of which we have in abundance these days. There's a reason mosquitoes are known as the world's deadliest animal, leading to hundreds of thousands of deaths every year. And mosquitoes aren't the only animals making us sick. As cities spread out and we turn more wild spaces into housing and commercial developments, humans also come in contact with more species, and this contact can lead to more zoonotic diseases, or diseases that transfer between humans and other vertebrates. Warmer temperatures also means more and more species will change geographic locations to find more comfortable places to live. That leads to species that have never interacted before before coming in contact and sharing parasites and pathogens. Over the past 80 years, many of the most infectious diseases that have emerged worldwide, including Ebola, Zika, and COVID, have been zoonotic, and they cause 2.7 million deaths every year. And all of these environmental and health concerns come with even higher risks for children and elderly people, people with existing health conditions, marginalized groups, and people in developing countries. In 2019, 135 million people suffered from acute food insecurity, meaning their lives were in immediate danger because of their lack of nutritious food to eat. In 2022, that number jumped to 258 million people, and increases in heat waves due to climate change could bring an additional 525 million people into food insecurity in the next 25 years. In fact, we're already seeing food production decrease because of climate change. A decrease in production will put even more stress on our food distribution systems. The vulnerable populations hit hardest by climate change and its health impacts are also the ones least likely to have access to adequate healthcare. As of 2021, 4.5 billion people, over half the people on Earth, didn't have healthcare coverage for essential services. That lack of coverage is leading to more sickness, more poverty, and more death. Almost 8 million people die every year because they don't have access to quality healthcare. And in 2019, out-of-pocket healthcare payments led to 381 million people being pushed into or further into extreme poverty. That's all a lot, and it's still not even everything we're dealing with when it comes to the way climate change affects our health, which can be really scary and overwhelming. But like I said way back before dragging you through the thawing permafrost to get anthrax and a bunch of mosquito-borne diseases, we can do something about this. In fact, we're already doing something about this. That's the reason we know about any of it in the first place. See, public health organizations are working hard all over the world to track the effects of climate change, understand the impacts on health, and help communities come up with strategies for staying healthy in the face of so many climate-induced attacks on our health and well-being. Internationally, organizations like the World Health Organization, which is made up of doctors, scientists, and epidemiologists, work to prevent disease and promote health across the world. For example, in 2022, 33 million people living in Pakistan were affected by unprecedented flooding. Experts from the United Nations and other organizations came together to help reconstruct healthcare facilities, add nutrition stabilization centers for areas affected by floods, provide thousands of healthcare workers with supplies and equipment, and distribute almost $50 million in healthcare products and treatments across the nation. This work didn't solve everything, but it wasn't just a short-term response to the floods. While the area is still recovering, the UN's response can help transform an unreliable healthcare system into one that's much better able to meet the community's needs in the long term. In the United States, several public health organizations fall under the U.S. Department of Health and Human Services. For example, the Centers for Disease Control and Prevention, or CDC, monitors and researches diseases, trains healthcare workers all over the country, and works to increase public awareness about vaccines and other preventative medicine to stay safe and healthy. There's also the National Institutes of Health, which focuses on research, the Substance Abuse and Mental Health Services Administration, the Food and Drug Administration, and the rest of this giant agency alphabet soup org chart. In Alaska, the CDC has been monitoring the many environmental and health concerns there and working to build resilience in Alaskan communities. For example, in the tribal village of Wainwright, the CDC provided funding and tools to support initiatives run by the community. These initiatives taught residents about the health risks of climate change, including the risk of using snowmobiles in unsafe locations as sea ice continues to shift. The CDC also helped fund a program in the Sitka tribe to test and monitor shellfish to ensure it's safe to eat. And the CDC is monitoring similar health and climate change concerns in regions across the United States and working with local organizations to implement programs to improve health outcomes. The work of public health organizations is crucial for recognizing environmental threats and their impact in helping communities respond. They can provide the training, information, and resources needed to keep people safe in the face of huge environmental concerns. And that's not just crucial for human health, it's crucial for the health and well-being of our entire planet. That's because public health isn't just about health, it's also about sustainability. In fact, good health and well-being is one of the UN Sustainable Development Goals, or SDGs. Which reminds me, I'm still going strong on my goal to crochet 24 dog sweaters in 2024. I've made 1.5. Don't judge me, I've been sick. See, in order to reach our sustainability goals, we need to be healthy. In order to be healthy, we need healthy environments. And in order to have healthy environments, we need healthy people who can do the work to clean up and protect those environments. Like so many other things when it comes to sustainability, we're caught up in a complicated cycle. But that cycle is why public health is such an important sustainability strategy. Protecting the health and well-being of people is necessary for protecting the health and well-being of the planet, which is necessary for ensuring safe and healthy futures for all of us. If you're enjoying this series and are interested in taking the full Study Hall Sustainability course and earning college credit from ASU, check out gostudyhall.com or click on the button to learn more. And if you want to help us out, give this video a like, comment your favorite mosquito repellent, and smash that subscribe button. Thanks for watching, see you next time.